Britain today recorded a further 10,625 coronavirus cases and 799 deaths in 8 another sign brutal lockdown measures have turned the tide on the second wave, as a top expert said fatalities from all causes could fall to normal levels as soon as next month.
Department of Health figures show daily infections dropped by 14% compared to the same time last week when 12,364 were recorded, and had plunged by 37% from 2 weeks ago.
And COVID deaths had also dipped by 25% compared to last Tuesday, when 1,052 were registered.
But there are signs the UK's coronavirus vaccine rollout may be slowing after fewer than 280,000 doses were administered yesterday. Officials have blamed patchy supply for the inconsistent figures, with vaccines minister Nadhim Zahawi saying today that doses were finite at the moment.
Eminent statistician Sir David Spiegelhalter, from the University of Cambridge, said today he was sticking my neck out and predicting all-cause deaths could tumble to normal levels by next month.
He told Times Radio, compared to the first one, COVID wave, we went up really fast, because we weren't taking any measures really at all. We were late putting in restrictions. And we went up very fast, in terms of deaths. And we came down really quite slowly.
This time, we went up very slowly, throughout autumn, then with the new variant went up faster over Christmas, but we're coming down actually remarkably fast. It is extraordinary, especially that there is this new variant. And then with the vaccine starting to kick in, we're really seeing a very rapid fall, I think better than most people would have expected.
His comments came after Office for National Statistics data today showed 7,320 victims had COVID mentioned on their death certificates in England and Wales over the week ending February 5. This was a 13% drop from the previous week, and the first time that the number of weekly victims linked to the disease had dipped since the 7-day spell ending December 25. The latest data also showed every region in England saw COVID deaths fall compared to the previous week. And the number of deaths from all causes also fell by 7%. In other developments today, Nicola Sturgeon revealed schools in Scotland would return on Monday, as she set out the devolved nation's roadmap out of lockdown. Her blueprint comes 6 days before Boris Johnson is due to make his announcement.
The First Minister also warned people not to book foreign holidays and said the shutdown in Scotland, which is bearing fewer cases than England, is unlikely to end until April. And it comes after the UK's vaccine minister today claimed it is up to businesses to decide if they want to require proof of vaccination before serving customers. Nadhim Zahawi ruled out the government introducing a domestic vaccine passport as he said the nation's vaccination program and mass testing are the best tools for getting life back to normal.
A further 1.7 million people in England are being told to shield from coronavirus and everyone on the vulnerable list is being urged to stay at home until at least March 31st.
The Department of Health announcement pours cold water on hopes that lockdown rules could start to be drastically eased next month, suggesting medics don't think society will be safe.
This is despite the government smashing its target of vaccinating 15 million of the most vulnerable by February 15. There had been hopes that, once those most at risk were jabbed and developed immunity several weeks later, that the most draconian curbs could be lifted.
Officials said the shielding list, which was first drafted up almost a year ago, was being almost doubled after 10 scientific advisors identified additional adults at serious risk of COVID using an algorithm.
The DOE did not say who would be added, but the updated list goes beyond looking only at underlying conditions and includes other risk factors including age, weight, ethnicity and level of deprivation.
Of the 1.7 million new shielders, 900,000 have already had their first dose because their age or medical history made them eligible during the first phase of the rollout.
But health chiefs are now racing to immunize the 800,000 who were missed during the first wave of vaccinations. They will be prioritized, health chiefs said.
People who are shielding are advised not to leave their homes at any time, except for brief exercise or medical appointments, because they're at much higher risk of being hospitalized or dying if they catch the coronavirus.